All right, good evening and welcome. Dr. Scott Stoll, co-founder of the Plantrician Project. And again, we are here with our incredible series that has been a real journey of taking the evidence and the background of lifestyle medicine and really teaching you how to practically apply that in your practice. And not just the nuts and bolts, but taking it all the way down to billing, the finances. And tonight we're going to talk a little bit about how to actually translate that into real world assistance for your patients to leave the practice and to go home and understand what to do and how to do that. And that's one of the biggest gaps in healthcare today is what happens after the visit. And if we really look at adherence across all specialties, all prescriptions, adherence generally in medicine, whether it's prescriptions or physical therapy, is 50% at best. So 50% of what we are prescribing as clinicians is adopted at some level, and 50% is not. So filling that gap between visits and providing real, meaningful assistance, guidance, resources, and support is that is the gold of lifestyle medicine. And tonight, we're going to learn about the tools that ProNex has created, especially Deepa's incredible depth of knowledge in lifestyle medicine that has been integrated into a system that can come alongside of you and your patients and make the practice of lifestyle medicine joyful for both you and your patients. So with that, I'm going to turn it over to my beautiful co-host tonight, Karol Clark, and let you take us in from there, Karol.
Awesome. Thank you so much, Dr. Stoll, and all of our friends at Plantrician. We have thoroughly enjoyed having this series with you and for all those lifestyle medicine practitioners out there who do such great work. And yes, this is so great because of the clinical experience right here and knowing what works and what doesn't. And we're really excited to have everybody here. So tonight we are talking about from intake to long-term adherence. And this really is, as Dr. Stoll mentioned, a challenge for every practitioner because of the fall off rate. Life gets in the way, and we have to be prepared for that and have a way to stay in touch with them. So that's part of what we're going to not only talk about tonight, but demonstrate a great way that you can do that. It is so hard for me to believe, but we are on week 6 of this series already. So we've already taken your vision to viability. We've talked about designing a program that fits in with what your life goals are and your business goals, how to attract clients, scalable revenue models, very realistic information about how lifestyle medicine you can make money, as we all need to in order to keep our businesses going and thriving, no matter what setting that you're in. And then metrics that matter. And tonight, of course, the topic that we were just talking about. We're gonna just a quick recap from last week. Metrics that matter. We were talking quite a bit about financial metrics, but also the other ones that really fuel your decision making in your practice. Numbers don't lie, and metrics are so important because it keeps you from getting down the road and then realizing there's a problem. So if you haven't watched that one, I do encourage you to go back and watch it. And tonight we're talking a little bit about the gap, what we assume patients need versus what they actually want, the patient journey and what those 6 stages are from discovery to long-term retention. We're going to do a journey deep dive and simplify some of this for you. And then we're actually going to do a live demo. Deepa is going to show the intense amount of time and effort that has gone into building a platform that is specifically it's designed to deliver the 6 pillars of lifestyle medicine, not just deliver it, but track it and keep your patients engaged. So I am so excited about that. And we're all about character so that we can bring this to life. And I'm going to let Deepa share a little bit about our new character that we're introducing this evening.
Okay, so far we have introduced Dr. Marcus and Miss Maya, and we laid the ground for you guys that no matter which setting or practice style or practice location or uh, the specialty you are in, you can apply the insights that we have given you until now and really get the get your dream, your passion into action. Okay. And as I mentioned, this applies to all kinds of clinical settings, or even non-clinical settings. If you are a coach, you are working on your own, you could be a dietitian as a clinician, or you could be working for an FQSC or a community organization. So I am going to urge you to go back and really look at all other episodes that we have done, and start applying that knowledge, or at least start putting your plans together. So until now, we had two characters, Maya and Dr. Marcus, but today we are going to we are going to go even further than that, and introduced our patient Stella as our third character of this story, because this is where it gets real. This is where we see, this is where we all get to practice what we have been passionate about, but there are a lot of nuances around that. So now we are going to see the Stella's journey, and Stella represent our typical uh, patient population, client population, chronic diseases. She lives with her kids and husband, works full time. So, she's juggling life and work-life balance. And no matter what disease condition has, Stella's one goal, or what she wants, is she's ready to change. She wants to change, and she wants to feel good. Okay, she's not asking for anything more than that, but she just want ways how we can help to get her to that point. She doesn't want more information. What she needs, what I guess what she wants and what she needs, little discrepancy there. We think she needs more information, but what she wants actually is a clear journey where she can actually understand and follow, and something that flows with her work-life balance. So that's meet our third character in the story, Stella.
And
Yeah.
Deepa's going to talk a little bit more. She started a little bit, but there is this gap about, as a clinician, and we've all been there. We think people need all these different things, and then you may have a conversation with your patient and you find out that's not what they were looking for at all. And so that discovery is so important. But Deepa, I know, is going to share some of these discrepancies that occur at times.
Yes. So as I was mentioning, that we assume that patients want more education, which is extremely crucial. It definitely helps them become aware of the problem. It helps them become aware that how powerful the 6 pillars of lifestyle medicine is. However, to translate that into reality, she is looking for clear steps, not a overwhelming situation where she goes home with a binder and classes to get enrolled in, and every day the modules are being delivered, and who knows whether she's watching or not, or how she's being compliant. We assume that more touch points show we care, okay, which is good. However, the touch point needs to be meaningful for Stella. She doesn't want too many check-ins or nudges. What she wants is a support, and that is another gap that we notice is patient doesn't want just reminders. Oh, did you walk today? Did you do this? Did you do that? That's not what we think. That's what they want. Sometimes we have been very helpful, but where Stella is, she's like, oh, can I just do one thing at a time, and can we go at that speed? We assume that complexity signals thoroughness. What does that mean? Oh, if we have her track her sleep, and then CGSM, her antioxidant intake, her calorie count, her macro, her micro, more integrations that we have in our system, the more tracking she will do, all that data is good. But it has to be delivered in a systematic manner, and it doesn't have to be all started at one time, because for Stella, that is again very overwhelming, and she starts to get into all or none philosophy. In what I learned after few months of working with patients is I assume that when they are not doing well, they will reach out to me. But that was not the case. They reached out to me when they had hit the bottom. So I started talking to people about, please, as much as you like to send me your best behavior, I want to make sure that you are reaching out to me when you are sinking, when you are feeling overwhelmed, when you are unable to make the decision, when you feel defeated, when you have a slip off. And uh, and that took a lot of pressure off of patients' chest, because they look at us and they say, oh my goodness, I have to be perfect, I have to be on top of things all the time. But look at our Stella is juggling so many things. So assuming that patient will ask us if they are confused is another gap that we see in terms of patients actually engaging with us. So these are some of the gaps, Carol.
Right. That is so true. When you talk about you think that they will reach out to you, I don't know how many times I've seen, particularly in those seeking weight loss, that they'll usually reach out either when they're doing so great and they want to share it with you, or when, like you say, they're at rock bottom. So being in tune with that is really helpful. Um, Very important. So what happens if the patients don't usually fail, as we mentioned, because they lack information. They disengage because it's too overwhelming, as Deepa just very succinctly mentioned. And what that results for you from a business perspective and just from a caregiver's perspective is lost revenue, lost patients, lost outcomes because you really want to help these people. And then it also leads to provider and team burnout because you want to help people, but you're dealing with this disengagement, and it's very frustrating, and it can really pull you down. So we want to make sure that that is not happening. And when we talk about the patient's journey, there are 6 different stages that we've identified here. We really already talked about the first 2 stages. And as we all know from the marketing perspective, every patient journey begins before they ever find you. So they see a video of you, they see that you were on a podcast, they see an ad that you had, all those different things. They discover you, all those touch points matter. And then they may have been referred, which is really even better because they can have a higher trust factor. And then you and your team work really hard to respond to them when they inquire, to nurture them, to reduce any no-show if you get them scheduled for a consult, and anything you can do before the first visit to convert them from being interested to actually selecting you in your practice for their care. And a lot of this results in how they felt about the experience. We do want to do everything we can to have a wow experience, to be a little bit different. And what do I mean by that? It means that, you respond right away when you get a new inquiry. You actually listen to the patient and understand what their goals are. They can feel that that's a little bit different than what they find just online somewhere, or maybe what they've experienced in other offices. So that's really important. And then what we want to do is just streamline this whole process. And oftentimes, as practitioners, we want everything perfect. And so we hesitate to even start our practice, as we mentioned, or we don't really dive into our patient journey. We figure, well, we know how to take care of these patients. We'll figure it out as we go along. But there is really an important part of sort of engineering that whole experience. And so that goes on to the onboarding. What's that intake experience like? Are they filling out their paperwork on their intake and registration online? Do they have to fill out a bunch of papers in your office? Are they able to access the portal very easily, or is it confusing for them? What are the expectations? Is it clear to them? You're creating confidence with them when you make that very smooth and very clear to them. And then it helps them know that they made the right choice. And as you onboard them, then of course it's the matter of engaging. They're all excited at the beginning, usually, but we also need to make sure they understand the six pillars in a very simplified way and have it all organized into one easy plan, starting one step at a time. And so that can really be done now within a software setting, even though you may have done that in other ways in your practice, and you can blend that. But a visible plan makes that much easier, plus having consistency between visits. And all of that also plays into how to scale your practice, as we talked about in the third episode. It's all about making sure that you have those touch points, and then making sure that you actually document and code and all those sorts of things properly if it's an insurance situation. And that's applicable whether you're cash pay or insurance, and as we've mentioned over and over, no matter what setting that you're in. And then we have to help them navigate. They're going to have plateaus. They're going to have medication transitions if they're on anti-obesity medications or some other medications as they are improving their health. Life disruptions that just happen. You know, it could be an injury, it could be an illness, a death in the family. All those things we need to help them navigate and help get ahead of that so that when they do have those situations, they know exactly who to reach out to, how to alter their care, how to communicate with you. It's really important. And then, of course, sustaining that relationship for that long-term lifetime value, and also for to get more referrals from these patients. But what does done mean in your program? Do they have like a very nice, easy to follow pathway that can pause as needed in between? What does maintenance cadence look like? How is that set up in your practice? What's the alumni structure? So once I've graduated, so to speak, what do I do after that? And then how do I know how to give you a referral? Is there a way for me to do all my reviews? You make that easy? Do you ask for those? All these six stages are what makes that smooth patient journey so that they have such a wonderful experience. They actually get the outcomes that they want, and they want to tell so many other people and send them to you as well, because you've essentially, as you know, it's so rewarding. You've changed their life. You've made such an impact. So these are the six stages of the patient journey. We want to be able to simplify that for the patient so that they stick with you and so that they can get the outcome that they desire. And that's satisfying for everybody, you, your team, and all of them. So the great patient experience, we were talking about a wow experience, doesn't happen by accident. As I mentioned, it's built into the systems behind your practice. And this needs to be consistent, and it needs to be something that is the same for your patients. Even though you may customize their plan, the experience needs to be set up so that it's not confusing for your team, it's not confusing for you, and it's definitely not confusing for your patients. So we've already talked a bit about discovering and converting them. And that's, as we talked about, you want to make sure you're getting your leads, you're automating the nurturing for them. You want to lower that no-show rate. Onboarding and engaging. This is basically just another way to sort of show that those six stages, but you're onboarding and engaging them. This is where you're implementing the six pillars. And if they're on GLP-1s or you're utilizing that, you're supporting them, you're making your modifications. It's very easy communication back and forth. You can also integrate some automated education in bite-sized pieces that can be tracked, and you can have the software that helps you know, did they open if it was a PDF, did they view the video, did they take the test that was partway through the video, did they do all these different things? And then the patient portal is where they really stay engaged with you, and they know that you are there anytime that they need you. And then, of course, for navigating and sustaining the patient portal messaging them, and perhaps it depends on your model if you're doing a membership or if it's visit based. But all those things are what will help navigate and sustain the patients in your practice. And there's also, I know AI, everyone has different views on it, but it really is making a positive impact, as many of you probably know, in terms of documenting your notes. And we have also integrated a lot of AI recipe generation, and there's lots of just wonderful things that can be done in a very safe way with the use of AI in the software. So before we get to the demo for the software, Deepa's going to talk a little bit about what we find when we meet with practitioners in all different settings. We get into this bit of a dilemma, and we want to simplify this dilemma for you so that you can move forward.
Uh, one more thing I want to pile on to what Karol just said about the previous slide and about engagement, onboarding, and sustainability of the patient is extremely important. Because if you are a organization and you have applied for a grant, whether it's a state grant, whether it's a federal grant, or doing some reporting related work as it relates to lifestyle medicine, it is extremely important that you have mechanism in place to keep these people engaged and uh, sustain their their engagement over a period of time, because that is the outcome that the grantees are looking for. And I have been through the grant journey few times, and one of the reasons that why I got into this business of looking for a software solution to and ended up basically collaborating with ProNex to create one was, after getting the grant, our existing EMR did not have the right functionalities, features to capture what is required for lifestyle medicine outcomes. There are tons of EMRs out there. And I'm sure, just like Maya and Marcus and myself and Carol, we have spent a lot of time looking at which EMR is right for me. You are thinking about, you are spending time on, should I try a free version or should I try a paid version? You may be thinking about what features do I even need for lifestyle medicine? Is there a system? Is there a EMR which is specifically designed for lifestyle medicine? Do I even need it? If you are already working in an organization or FQSC or a hospital and you want to start a lifestyle medicine program, you may be probably thinking, why can't I work with one of the big EMRs that my organization actually has and kind of work around it, right? Do I need integrations? How many integrations do I need? What kind of integration? Is there a cost? Is there a perfect solution? I cannot tell you how many providers I have spoken to in last 2.5 years who are stuck in this EMR dilemma. Okay, and at one point I tell them it's over analysis is leading to paralysis. So just, if you're not willing to take the next step, don't let this stop you from moving forward. Okay, but because this series is very intentional in terms of helping you guys not only launch your practices but scale it. Because I was talking to Dr. Scott last week, I cannot tell you um, how right the timing is for lifestyle medicine right now. The reimbursements are getting better, the codes are getting better. There is more awareness among our patient population. The word is not a obscure word anymore. People are looking for providers like us. We have to make their journey uh, easier, less friction in terms of financial model, or the services we offer, and how we are going to help them navigate through this. So therefore, the what kind of EMR do I need really depends on, if you have done the homework until now, you hopefully that will help you answer what kind of EMR you need. It depends on what kind of practice you have. If you are getting into lifestyle medicine, then it is not, as we know, one and done type of intervention. It's not a pill that we are prescribing and patient goes and swallows it. It is like, it is a journey that we take with them, along with them.
Right. So what we want to do now is to share a demo of the core LMP EMR, which is been designed specifically for lifestyle medicine practitioners. You will see the experience of people like Deepa and many Plantrician members sprinkled throughout, because this is made through real life. It's been designed to really lower your administrative burden so that as patients come in, it's easier to nurture them. It's easier for if you're using a VA or your team that's there to make sure that they're ready to go for their visits. It makes it so much easier to prescribe and track the 6 pillars of lifestyle medicine. And there's also AI integration with simplified plans that you can prescribe to your patients, ethnic appropriate recipes, full EMR capabilities, and also, as I mentioned, the ability to track and nurture leads. So we're going to hop into that. I'm going to stop sharing and let Deepa take over. She's going to drive the demo, and we'll move through kind of as a question and answer.
Yes. Karol, do you want to briefly talk about the lead capturing?
Sure. As we talked about throughout this whole series, patients find you in many different ways, but very often, it's through searches and it's through a digital door somewhere, whether it's one of your social media channels or whether it's your website, and the ability for them to come right into your EMR core LMP platform is so important. And a lot of times you don't have this. So we've designed actually a way for you to see exactly how many leads came in today, how many leads came in yesterday, how many leads this month. We want to keep track of those metrics. And then we can also track, where they came from. So we start with that first part of the patient journey. So that's where every patient starts. It's the digital door. And that leads to this sort of a snapshot page, which is nice. And it also reduces a bit of the admin burden because it begins sort of your care before it reduces that admin burden before your care ever even begins. It's all in one place. The other cool thing is every time a lead comes in, it's one place for all the communication. So whether I'm reaching out to them to see if they're ready for the next step, or whether Deepa is, it's all in one location. I'm not looking for a phone message and an email here and all these different things. It's all maintained in one location. So that's really helpful from a lead perspective. And Deepa, then once the admin team converts the lead into a patient, can you walk us through a little bit about what happens next?
Sure. So this is where, like Karol said, once you log into the system, you get to your main dashboard, which is where the leads are coming or new patients have been enrolled by your admin. They may not be patients that I interested clients who, if you have specific program. So once the lead comes in, as Karol mentioned, you can communicate with them via SMS or a phone call. And once they are ready to get enrolled in a program, then they will get added as a patient. I mean, they get just their status changes, and we are going to use Gina French as our demo patient. And so Gina came in as a lead right here. My admin spoke to her via SMS or email. She decided to get enrolled in a program. And depending on whether she's part of a group visit or she's going to have an individual appointment, the system allows you to add her to group. And based on the tag that we have given her, we can add that tag, and she will and a group appointment with other 5, 10, 15 patients will be done. After that, she will get the intake and registration forms. And these are just some of the examples of these forms. You can have lifestyle assessment form, you can have depression anxiety assessment form. All other relevant intake and registration forms can be added here, and she is going to get those prior to her visit. Now, once the registration is done, or we call it a check-in workflow is done, And when she comes to the visit, you click on her, you get into her record, and as you can see, this platform is specifically designed for lifestyle medicine. So it definitely has all the necessary pillars that are required for you to start delivering lifestyle 6 pillars of lifestyle medicine. You can now start her visit. Now, just like the standard EMRs, this platform does have all the necessary functionalities required for you to do a standard medical visit. But what is really unique about it is what you see on the right-hand side within the visit note. You have lifestyle assessment that you can easily access. Her intake and registration forms are right here if you need to refer to. If the person is on GLP-1 medication, you can see the compliance. And this is extremely important because here you are seeing the compliance with the medication along with the metrics, any adverse signs and symptoms the patient has reported. All of it is just right within the visit note and easily accessible. This anti-obesity medication is triggered, the log is triggered from the patient side, and we will be showing you the patient portal as well. Food log, picture-based food log, you can review that. You can flag it if you want to talk to the patient next time about it. Karol was mentioning about the educational portal. You can see all the handouts and videos that you had assigned to the patient and what is available if you want to assign something. The coolest thing where I think that this platform really excels is the way we have designed the actual delivery of lifestyle medicine in a prescriptive format.
Can I mention one thing about education real quick?
Sure.
I think one of the great things too is with the partnership with Plantrician, for those that are members, there's actually access to many of those handouts that you may be handing out to them in the office or something like that. So it's really great that there's also some pre-populated information in there for you to use, so you're not starting from scratch everywhere. And they are just the highest quality. They're great.
Yes, yeah, that's a great point, Karol. So those are already preloaded in the system. And going back to lifestyle 6 pillars prescription, instead of having patient write their goals and track their goals, we decided collectively that the best way is what if we start prescribing just like medication, because as healthcare professionals, we are trained to prescribe, and as patients are more compliant when something is prescribed to them. And you can prescribe or you can build a new prescription for any one of the pillars or all of them, depending on what your patient wants. And that's how the prescription is built. And then once you save it, it gets sent to the patient, and I will be taking you to the patient portal soon. So that's how basically the lifestyle prescription functionality works. Another unique thing about this core platform is food prescription. If you want to be even more intentional and write a specific prescription for anti-inflammatory food or for cancer, you can again build that right here. and you can be more intentional about the fiber content and the micronutrient content. And again, when you save it, it gets sent to the patient. Now, one of the issues that many providers have told us is, having recipe building capacities in their platform. If they don't want all the elaborate meal plans and you just want the patient to get started on something, so based on their ethnicity, provider can choose a couple of ingredients, select the ingredients, and within 30 seconds a recipe is generated. We have trained our AI to think from the perspective of lifestyle medicine, and you can tweak the recipes, but again, this is something very unique to this platform. So this is how basically core platform differentiate itself from not just an EMR, but EMR that is specifically designed to deliver and track key components of lifestyle medicine.
Right. And then Deepa, I'm just curious, you've used this with so many patients. What sort of response have you had from the patients in terms of their experience?
Patient like the simplicity of what they need, what they are required to do. And when I take you to the patient side, I will explain to you what I mean by that. But they like it that everything is in one platform. They love the lifestyle prescription concept because it makes them, oh, I took my blood pressure pill, but I also had my half a cup of beans. It resonates with them beautifully. And like I said, the simplicity of it and ability to communicate with us, because we can again send a message to the patient via SMS, call log, everything. So the entire workflow from provider side and the patient side really blends so well in this platform, making delivery of lifestyle medicine very productive, reducing the admin burden and even provider burden, as you mentioned.
Mm-hmm. No, I love it.
So now we'll go to the patient portal. So this is what patient sees when they log into core platform, and there are a variety of actions they can take. Let's start from looking at managing their anti-obesity meds, which is a very hot subject these days. So here, this is where they have ability to log their medication. They can add their new medication here as well. This is where they will see the report of how many times they skipped and their overall compliance. And most importantly, this is where they report their symptoms that we saw on the provider side. So the reason of having anti-obesity medication tracking system on the patient side is for that self-efficacy and empowering the patient to engage in their own care. So that makes them more responsible. It improves the compliance, and then we can catch them when they report the symptoms instead of waiting for the next visit. Now, in the patient portal, you can do a variety of things. The educational material that you have sent, it comes under this tab. If you have enrolled them in any specific programs, they will be able to see the modules here. The lifestyle prescriptions that we sent them, those are trackable in this screen. And this is how they are keeping track of it. The picture-based meal log that I showed you on the provider side, this is where it comes from. They just take a picture. They have to click on the food groups, and the log is viewable to the provider and to them. So that's a little bit about meal logging. the food prescription, the intentional specific food prescription that we have sent them if their pathology looks disease pathology looks very serious and you want them to follow certain things, it comes here. The recipe that the AI recipe builder created, it comes here. So all in all, what can I say?
I know it even has a grocery list. I love that. So I can very easily go to the grocery store and pick up what I need.
That's right. And it also gives you alternate ingredients and the meal planning tips. So that's how much in detail this platform goes. They can send a internal message here, which obviously provider gets. There is a very simple way of tracking. I have seen a little bit of a tracking fatigue in my patient population, especially if you are dealing with underserved population. They may not have access to all the tracking devices. They want something simple, easy, and relatable. So that's how basically this platform is designed. It is designed based on real life experience of working with uh, patients from all different walks of life, different ethnicities for last 20 years, along with insights and nuggets from Dr. Scott and a lot of other Plantrician providers that have helped us bring this to life, along with Carol's experience on managing the business side of practices. So yeah, that was, I hope, a comprehensive demo for all of you to see what this ProNex's core platform, lifestyle medicine platform, is all about. Carol? No,
Right.
Scott?
Yeah, I didn't know if Dr. Stoll, if you had some something you wanted to add there before we move forward or
But
answer questions. I think there's some chat things.
mute.
Oh,
No,
oh,
no, Scott, you are on mute.
That would certainly help, wouldn't it? So yes, I was just going to read some of the questions to you, and that you can answer them. So let's see. Let me find any specific. How do people access these services with in kind of different education environments? I guess how looking at access for people in different cultural environments or maybe even languages. Deepa.
So we are working on making it multilingual. At some point, it is on our roadmap. But when it comes to accessing it, if you are a provider and if you are looking for a EMR, uh, instead of getting a standard EMR, which is out there, you can choose ProNex's core platform as your EMR. And if you just want to use the lifestyle medicine side of the platform and you don't need the complete EMR, that option also exists because it can stand next to your existing EMR. So you don't have to replace the entire EMR system. You can just choose to use only the lifestyle medicine platform.
And we find that more common, such as in larger healthcare organizations where they're required to use one for the EMR, but yet still want to deliver a very personalized lifestyle medicine experience for their patients and the ability to track that.
Right, that's wonderful. And somebody mentioned, billing, and I'll kind of broaden the question. The question was about Medicare, Medicaid, but the system assists with creating billable encounters for patients with lifestyle medicine, correct?
Absolutely. If you have seen our series, our episodes, or I would say last 2 times, right, Carol? We
Yes.
had Sumit from Abstract Billing, who really understands ins and outs of billing in general, but as it relates to reimbursement for lifestyle medicine in lifestyle medicine space. It is unbelievable how much how that financial model can be built, and again, regardless of the your work environment.
Right. And do you want to talk a little bit about how that billing occurs, Deepa? Because obviously you do billing through yours as well, and the abstracts role.
Correct. So what we learned from Sumit's conversation with Sumit about reimbursement and billing is there are nuances of how you bill in terms of monitoring visits or remote patient monitoring devices, how to do collaboration with a dietitian, and new health coach codes are coming up. Then there is reimbursement available for food as not food as food as medicine prescriptions or meals and groceries. So knowing where to go in to look for those reimbursable opportunities is what is required, and the you need to have a good billing system. But in order to build that, you need to have a system on the other. I mean, you need to have functionalities on the other end for the provider to document all this uh, these factors.
And my experience, and I know Deepa is the same. This is the only seamless end-to-end system that I know of in the market today that can take the EMR components and the lifestyle components with the business component and create a system that assists you in integrating lifestyle medicine into your current practice, even through traditional healthcare channels, and come alongside your patient in a really meaningful way and assist them with integrating lifestyle into their lifestyle, no matter where they come from. And that's why Plantrician Project has partnered with ProNex, because we believe this is a system that can assist any healthcare professional, from health coaches to physicians, in any system in creating an opportunity for lifestyle medicine to truly change lives. And importantly, for all of us healthcare practitioners, create a system that is not burdensome and allows us to get paid for our services. So it is really an elegant system. And I hope this entire series has been beneficial for you. It is one of the only series that I know of that helps walk you through the entire process of building the business of a lifestyle medicine practice, from vision to execution to integration to finances, and finally assisting patients in their transformation between visits. And so we have one more one more session next week, and I'll let Karol tell us about next week and our homework.
Right. Thank you, Dr. Stoll. For your homework, there is a homework sheet. I'll put it in the chat here, but we want you to map your current patient journey, really look at it and check for gaps. It's easy enough just to, even if you just have it jotted down on a piece of paper, but I know like when I go into evaluate practices, we map the whole thing out, make sure everybody's on the same page. Where is it great? Where are there gaps? Where do patients fall through? It's so important. It is like you could be a sleuth. Once it's all documented, you can kind of come in and really make a diagnosis from about what might be going on in your practice. So check for gaps, simplify each step, make sure, go through it as a patient, someone, either you or someone you know, to experience what's it like to get that link and to fill out all your intake and registration forms. What's it like to go in and check your homework. So we want to make sure that you check that, simplify each step, and then really create your ideal patient journey blueprint. It can make a huge, I've seen this make huge impacts in people in practices all over the place. So it's a really helpful thing to do. And the next session, we are going to put it all together, kind of go through the pearls from every single part of this this 6-week series. And that's going to be a lot of fun to do together. And we'll kind of simplify it even more for you, because just like we're simplifying it for our patients, we want to simplify this process for any practitioners, no matter where you are in your journey. So that's our goal for next Thursday. And then we're actually going to continue having some office hours with some topics that people have recommended or requested. We'll be going ahead and doing that as well. So it won't be just ending next week. We'll be doing some more things after that.
And we have some really unique guests line up to come and help us out during our business hours in next few months. One being somebody who really understand the philanthropy and fundraising and grant writing space. And some of the insights that you guys are going to get are absolutely going to be phenomenal. So we are looking forward to it. And as much as Carol, she takes care of the how to run a business. For me, being a clinician, it's all about how can I make sure the Stella, my patients like Stella, when they come to me, I give her what she's looking for. Remember, which was to feel better and have energy and play with her kids. And when she sends me an email or a text showing the picture of she actually having energy to work, to play with her grandkids, or having energy to climb the mountain, on the top of the mountain, I feel my system and myself job well done. And I hope that's what we want to make sure that you guys will be also able to do, again, taking that passion and convert it into action. So therefore the ProNex score has allowed me to move my almost 5,000 patients into this system and able to manage.
Mm-hmm. Same here. Yep. And we'll have other speakers. We have some part with, I know this don't glaze over, but the accounting side of it. A lot of times people forget about that, and then they find out that they're an S corp and everything goes through their personal taxes, and then all of a sudden they're hit with a big tax bill, things that that afterwards you're like, oh, I sure wish I would have known that information. We'll be covering some of those things as well. So that sort of thing. And I guess one of the other things people oftentimes talk about is, okay, we've seen ProNex now, we've seen the software. Oh gosh, that must be a fortune. But we've actually worked really hard, and we've created packages that actually start at $39 a month. And for the ability to deliver this entire platform for that, less than sometimes a meal out, you know what I mean, is amazing. So if anyone wants to see more of that or schedule a demo or anything like that, please reach out to Deepa or I. You can always sign up right at pronexinc.com for a demo, and we'd be happy to walk through that. It's nothing, no pressure, nothing sale. It's just one of those conversations to see how it could fit in with your practice. And a lot of times the one-on-one is where a lot of those questions come out. So we're happy to do that as well.
So thanks for joining us, everyone. Thank you, Deepa. Thank you, Carol. And thank you, Jill and Brooke, for being here on the Plantrician side. And we will look forward to seeing all of you next week, same time, same place. And until then, have a wonderful rest of your week. Thanks, everyone. Good night.
Thank you.
Thanks. Take care.
Bye.